Hello and welcome to Medical Shorts by Tutor IMG. In this video, I am going to discuss about post-traumatic stress disorder. So post-traumatic stress disorder is a psychiatric disorder that occurs in people who have experienced or witnessed a traumatic event. The traumatic event could be a natural disaster, it could be accident, it could be war, or it could be any kind of traumatic event. A simple way to remember the symptom of PTSD is by using the mnemonic, which is basically the trauma. So T stands for traumatic events. So it means a person had experienced or witnessed a traumatic event. R stand for re-experiences. So basically a person re-experiences such traumatic event by intrusive thought, flashbacks, and nightmares. A stand for avoidance. So basically a person try to avoid the places, people, object, activities, situations that bring distressing memories. U is that the patient is unable to function. It causes significant impairment in social and occupational functioning. M is for months. So basically the symptoms of PTSD starts within 3 months of the traumatic event, but it can happen years after as well. Majority of the time the symptoms improve within 6 months. Okay. A is for increased arousal. So what does it mean? Increased arousal that is manifested by poor concentration, irritability, insomnia, hypervigilance, and startled reaction. So the way you're going to remember the symptoms of PTSD by remembering the mnemonic, which is trauma, traumatic event, re-experiencing, avoidance, unable to function, duration, and increased arousal. The way you are going to treat these patients is the combination of psychotherapy, especially the cognitive behavior therapy. In pharmacotherapy, we have SSRIs, which improve with depression, they improve with sleep and concentration as well. You can give the patient short-term benzodiazepine for relief of anxiety, but do remember, start with the low dose and keep benzo for shorter duration of time because they are very addictive. The prazosin is a good medication that will help with basically nightmares. Okay, so this is how you are going to treat the patient of PTSD. If you like this video, kindly subscribe to our channel Tutor IMG, and thank you very much.